An unique medicine that has saved lakhs of preterm babies in the last few years. In this video, through a few question answers, we will learn about this medicine, which is named as surfactant. First question: what is surfactant? Actually, surfactant is a chemical which is found naturally in the lungs of our body. In the lungs, there are so many very small sized balloons like air filled bags which are called alveoli. Surfactant is produced inside these alveoli. The function of surfactant is to decrease the surface tension in these alveoli so that these balloon like alveoli can expand easily. As a result, the baby will not feel distress while breathing. Due to this action of this chemical, it has been named as surface active agent, in short as surfactant. Second question: what happens if the surfactant is less or cannot function? Now, if the surfactant is not produced properly due to any reason, or if the surfactant is deactivated by some mechanism, then the balloon like alveoli will not be able to expand properly. Just as an empty balloon takes more pressure to blow and expand, in similar ways, the baby will have much difficulty to expand the alveoli and thereby will have respiratory distress like rapid breathing, chest wall indrawing, low oxygen level in blood, and need for CPAP or oxygen support. Third question: when is the surfactant formed in the baby's lungs? When the baby is inside the mother's womb, in the last 2 to 3 months, the surfactant is formed in the baby's lungs. However, for surfactant to be formed in adequate amounts, it takes almost 9 months' time. So, if any baby is born before term period, called as preterm baby or premature baby, these babies have either low amount or deficiency of surfactant in their lungs. In addition, the more the baby is premature, the more the lungs are also not developed properly yet. As a result, these babies will have respiratory distress after birth, and this disease is known as respiratory distress syndrome or RDS. If surfactant is given to these babies on time, the respiratory distress becomes much less. In most cases, giving the surfactant one time is enough. However, another dose might be needed depending on the response to initial dose and condition of the baby. Fourth question: in which other baby surfactants can be given? Some term or late preterm babies pass their stool or meconium inside the mother's womb. In such scenarios, before or during the birth of the baby, the meconium mixed fluid enters the airway and lungs of the baby and causes many problems. One of such problems is that the surfactant in lungs gets deactivated by the meconium mixed fluid. As a result, the baby gets difficulty in breathing. Some babies may even need a ventilator machine support for breathing. This disease is known as meconium aspiration syndrome. And recently, in some medical research studies, surfactant was given in such babies and the result was beneficial. Fifth question: how is surfactant made? As I have told previously, surfactant is naturally present in the lungs. So, some pharmaceutical companies take out the surfactant chemical from the lungs of the pig or cattle and then purify it in labs and ultimately pack it in vials to sell in the market. Nowadays, some companies make surfactants in special process in the laboratories without collecting them from the animals. Due to the cumbersome preparation process, the cost of surfactant is a bit high. You can see surfactants of some brands here. The dosing is also important as it depends on the body weight of the baby. Sixth question: how is the surfactant administered? Medicine. As we hear the term, we expect that this is to be given either through oral route or via injection. But contrary to traditional belief, the delivery of surfactant is different. It is given directly in the airways so that it reaches lungs rapidly where it will start its action very soon. For this, we open up the mouth of the baby with a special instrument called a laryngoscope to visualize the vocal cords. Then an endotracheal tube is inserted in the trachea and the medicine, that is surfactant, is administered via this ET tube, and then pumping is done by a self-inflating bag for a few times so that the surfactant reaches up to the lungs. After that, the ET tube is taken out and the baby is placed on CPAP machine or other oxygen support. Nowadays, without putting a tube inside the trachea, the surfactant can also be delivered by using an LMA tube or by nebulization. But these procedures lack adequate evidence to support their use as of now. Within a few hours of administering the surfactant, the results can be expected as evidence of improvement in respiratory distress or pressure requirements. The side effects are not so dangerous, however, rarely it can lead to pulmonary hemorrhage. For these reasons, surfactant therapy has been proven as a very effective medicine in newborn babies, especially the preterm babies. If you have any more questions, please feel free to ask in the comment sections.